Hello and welcome to the Simply Free Little Talk Show. Thank you for tuning in to Health Matters. I have on the show today Dr. Linda Amerson, and she is here to talk about healthy hair and scalp treatment. She is an amazing doctor. She is internationally known. You're going to learn about her college, her university that she has created, and she's also an award winning hair and scalp products that they're award winning. And so she's internationally known. She is someone who has seminars internationally as well as locally in the States. So, without further ado, let me bring on an amazing, fabulous woman who I am so honored that I do know. Thank you so much for tuning in. Also, like, share, follow, and subscribe. And thank you for inviting someone to tune in because you want to hear what Dr. Linda has to say. Hello, Dr. Linda. How you doing today?
Hello, Free. I'm doing wonderful. Thank you so much for having me.
It is my pleasure to have you here. As I stated to everyone, there's so much to you. And many people, let's just go from now to the end of the interview. She is known as not only internationally known, but Dr. A. Many people just say Dr. A for short. And that name has just been stuck to you since right before what grad school it was.
Yes. It started after I received my doctorate. And people said, well, what do you want me to call you? I said, call me Dr. A. If Amerson is a challenge for you, just call me Dr. A.
If Amerson is a challenge, yeah, just say Dr. A. You make sure that you get it right then. So what I love about your amazing career, and I'm gonna start with something that no one would ever think I'm going to say. You are a writer, but also a singer and a songwriter. Now,
Yes.
this is the hair specialist, guys, but she's a writer, a singer, and a songwriter. Was
Yes.
this what something that happened later in life, or this is something that you've always, had, and then of course the love for hair just kind of kicked in?
Well, actually, the writing was something more of a process, which actually started once I got into trichology. So because during that time, because I've been a board certified trichologist now for over 30 years, and
Yes.
I've been 40 years in the hair and scalp care industry. So
Ooh,
once I became an expert, there was so much information that needed to be shared with consumers. And there was a lot of inaccurate information that was out there. So
wow.
I began writing for one of the local newspapers in Fort Worth. It's called the La Vida News, and just sharing some factual information. And that was a very good decision for me because it really gave my business a lot of exposure. And people who had never heard of the field of trichology, it really started giving them some factual information about what this specialty field was about. This is hair science. This is not hair care or hair styling. This is
Yeah.
hair science that I had taken it to the next level. And
Mm.
so with the articles, that continued to propel in other areas throughout Dallas. So I also would write specialty articles for several other newspapers.
Mhm.
So that's where that came about. And then with the singer-songwriter, you
Yes.
know, talk about stepping out of the box, Free.
Yes.
So
Come
I
on.
do
Tell me
come
about
from a
it.
musical I come from a musical family. So my siblings played the piano and the organ. We used to sing in the church.
Okay.
And so having that background, I hosted my first Cruise with a Purpose in 2012. And I wanted to do something as an icebreaker that was different.
Yes.
So I wrote an icebreaker and I put it to music. And I'm rapping and I'm singing and everybody's saying, oh, we love it. I
I
said, y'all
love
really like that? They
it.
said, yes, you need to put that to music. And I never thought that that icebreaker would
Wow.
morph into a theme song. So that's how that occurred as far as the songwriter. So I connected with a local producer. His name
Okay.
is Faz Clark. And
Fast.
I told him, I said, this is my first rodeo with doing this. Please be patient with me. I was not expecting this. He said, oh, it'll be fine. It'll be fine. I said, okay. So he worked with me and I wrote the different lyrics to the song and we put it to music. And now I have my own theme song for Cruise with a Purpose.
Now that's interesting because a lot of times we don't think of a doctor in singing, especially one that, and I love the way you explain. I'm gonna piggyback off of what you said, what trichology is. It is a science. It's not healthy scalp or healthy hair. It is a science to the hair and the scalp. And that's what made me want to bring you on so that you can clarify some things. You said there's misconceptions, and then you
Yes.
just have brought some things straight. So kind of share some of the misconceptions that you know that has existed in the hair world, whether it's
Some of
scalp
the
or hair.
misconceptions, yes. Um, One misconception I can think of would be pertaining to hair thinning.
Mm.
So initially, a lot of clients think when their hair begins to thin, that it's a hereditary factor. That
Whoa.
is not always the case.
Okay.
Uh, there could be other contributing factors to that, such as medication side effects. There could be surgical procedures that a person goes through. Your hair goes through different cycles, just as your health also changes. So this can cause different cycles to change as well as your hair and your scalp.
Wow.
So that's one misconception. And then as far as the scalp, when a person sees flaking on the scalp, they immediately assume that it's dandruff.
Ah,
And that is a misconception. It's not always dandruff.
hey.
I have seen so many cases of patients where it's a combination of different conditions.
Mm-hmm.
They can have seborrheic dermatitis combined with psoriasis, combined with pityriasis amiantacea, combined with neurodermatitis. So one condition is very rare that I see in
Yes.
my practice. Yes.
Wow, wow, wow. And so we are kind of misled in the area of the flakes in on our scalp. We ought to, because I mean, just you speaking of that, it made me think that's the first thing I would think if I saw like, white flaky things in my scalp or on my scalp.
Right. Right. Yes. That's a misconception. And that's because most people they don't know. That's not their area of specialty.
Mhm. Wow.
However, they just think, well, dandruff is a common thing. I think I just have dandruff. And then when a person has the flaking with the odor to it, that's
Mm.
definitely not dandruff.
Ooh,
So that
that's
needs to be
interesting.
addressed differently. Yes.
Hey, wow, you are really educating in a short time period. We're getting the scoop right off the bat. I love it. I love it. Woo, that's that journalism expertise behind your name as well. That you are thorough, and so we're getting the truth of the matter, and not really having to go too deep. You already know that this is your field of expertise. The trichology allows you to have that scientific, educated understanding that you can articulate to us. So I thank you for coming on, because just we learned about the flakes are not always dangerous, and even an odor can be associated with that. Is that a sign of some type of illness?
That's a more severe type of scalp condition.
Mm.
And in most cases, it is treatable and correctable. Yes, it's not always an illness that's associated
Okay,
with that because
that's
I've
good.
seen it from children to teenagers to adults who may be impacted with that.
Wow. So is it also association with how we clean our bodies? The hygiene is crucially important. I know you mentioned the men's beard and mustaches, and I
Mhm.
definitely want you to go into that because I want some men to get delivered.
Yes. Well, with that particular one, diet has a very important factor with
Okay.
that particular scalp condition. Also, yes. And also, even with psoriasis of the scalp, there are some deficiencies that is a direct correlation with psoriasis of the scalp and skin. So each person is a case by case basis.
Wow. And that's really crucially important that when there are things going on with the scalp and the hair, we can't just take it for granted that, oh, I'm a certain age, or because you
Right.
mentioned it's not necessarily hereditary. Oh, my grandmother's hair started thinning, or
Mhm.
my mother
Right.
was 35 and her hair started thinning. We really do need
Exactly.
to go to a specialist as yourself, such as
Yes.
yourself, and get, because you have a certain type of treatment that you do for us to be able to identify exactly what is the issue, correct?
Yes. So
Uh,
with my hair science analysis, um, we offer it's a 90-minute consultation.
mhm.
So it's very thorough, and we incorporate three different microscopes. So we use a
Wow.
polarized microscope. So with that one, we're actually looking at the hair bulb to see how healthy or unhealthy your hair is actually
Mhm.
growing. We can tell you what your water absorption, nutritional absorption, hair shaft defects, and structural damage is. We can also see if there is any hereditary pattern thinning.
Mm.
Now, there are 7 stages of severity when it pertains to hereditary pattern thinning. So I'll be able to tell a person that. Also, if there is clogging around the hair bulb, which usually is also affected by the hair follicle being clogged. So I can see that also, and that's usually related to the sebaceous glands activity. Some people
Mm.
who sweat a lot,
Yes.
that the sebaceous gland activity is more
Whoa.
active then. People who like spicy foods, they love the peppers, they love the hot sauce,
Oh,
and they just love spicy foods. Well,
yeah.
this increases the sebaceous gland activity as well, and I see a more oily scalp. So a lot of it is related to diet and things that people love to eat.
I'm
So
sitting here
that's with
guilty.
that.
I'm sitting
Yes,
here guilty.
absolutely. Our second microscope is called our trichoscope.
Mhm.
With that one, we're able to visually show the patient on our computer monitor their areas of concern.
Mhm.
If they complain about, well, this particular area is thinning, well, we can show them and we can see, is it thinning or is it patchy? Sometimes we see round or oval patches on the scalp. Sometimes there's scalp damage. We can see the flaking more clearly where we can actually show the patient. We can see inflammation of the scalp. Just so many different things. If a person has scalp moles, if they have discoloration, all of these things we can show them with our trichoscope.
Mhm.
Our third microscope is called the epigenetic hair bulb analysis. Now, that one is something that I incorporated last year. So, with my practice, I'm always trying to keep up with technology so I can offer the best service for our patients.
Thank you
So,
for
with
that.
that technology, it is fantastic. It's based out of Germany,
Okay.
and there is an S drive device. So, I extract 4 of the hair bulbs from a person's scalp. Now, if they are bald and do not have
Okay.
any scalp hair, I can still pull hair strands from their eyebrows.
Ah.
So I've had a couple of cases of that as well. So
Whoa.
we put the hair bulb on this S drive technology. It reads the data. So just for additional clarity, the hair bulb holds data from the past 90 days to 180 days.
Whoa.
So, as a good comparison, just like in
Yes.
drug testing in the hair, it holds that data from the past 90 days compared to urine tests. The urine test, it can be eliminated at a much faster rate,
Yes.
but the hair bulb holds that data for
Ooh.
90 days. So, this data will tell us everything you've been eating, if what you're eating is actually
Whoa.
being properly absorbed in your body. It also tells us if you're taking supplements such as your vitamins, your minerals, your antioxidants, your
Wow.
amino acids, all of these supplements, the amount that your body is absorbing and
Yeah.
what you are deficient in. So, for example, a lot of people talk about biotin. But Dr. Amerson, I take biotin. I
Mhm.
heard that biotin helps your hair to grow.
Mm.
Biotin in the correct amount, it will help. If you take an excessive amount of biotin, that causes your hair to have hair breakage
Oh
and it
wow.
starts falling out.
Uh,
So I had cases of that where they're taking too much biotin. So many patients, they are not aware of that.
Another
A-
misconception.
Another misconception. So stop listening to everybody.
I
So
like
your
that. Stop
friends,
listening to everybody. They don't
stop
know.
listening to everybody because sometimes, they're really not telling you factual information because they don't know,
Because they don't know.
because
Wow.
they don't know. So another area I'm seeing is, for example, vitamin C has been another very powerful supplement that a lot of people have been taking the past 2.5 years. It's very helpful for the immune system. But what happens if you're taking too much?
So really, let's just say there that too much can be too much. You taking too much of something.
Yeah,
That's why we should do it
these
in
can,
moderation.
yes.
Oh.
And and so a lot of people don't know what they're taking. Are they taking enough? Another thing is vitamin D3.
Ah.
I see where a person may not be taking enough because there's so many different, dosages of that. They have the 1,000, the 2,000, 5,000, 50,000. Now, usually when a person is very, very low in vitamin D3, their doctor will prescribe the 50,000
Yeah.
IUs is what we call it. And that's one pill per week. So that is more of a slow release in your system so
Okay.
that you can get built up, so you can get that built up in your system so
Okay.
that your body can have a more healthy immune system. So when you're not taking enough, I see scalp issues as well.
Mm.
So this S drive is very, very vital with
Yes.
knowing some internal deficiencies that you are unaware of. And then in addition to the nutrition, it also tells you other type of um, things that you may be exposed to that you're unaware of, such as parasites, such
Uh,
as mold, mildew, such
mm,
as virus in your system. All of that comes out on this report. So
all
I
the
have one report that's a 37-page report. It's a wellness report. So this device is considered a wellness device. It's not a medical device.
wow.
So we're able to really assist patients with a wellness report. And then also we can help those who are vegans or vegetarians. We have a separate report for them.
Mm.
And then also we have another one, hair, skin, and nails. Um, we have another one that's for people who have fur babies.
Oh,
So if you have dogs
wow.
and you want to make sure that your dog is being fed nutritionally what they need, we can actually test the fur hair bulbs from your fur baby, and
Oh,
it will give you a report to let you know how healthy your dog is. Dogs and
wow.
cats. Yes. I
That's
tell you,
amazing.
this technology is amazing.
Technology is, and it has come a long way. But I commend you for going the extra mile, taking that extra step to continue to educate yourself, and whereas your
Yes.
patients are benefiting from the educational knowledge that you have obtained. I love it.
Yes.
Absolutely
Yes.
love it. Thank you.
Thank
Which
you.
keeps
Thank
us
you.
healthy.
Yeah.
Which keeps us healthy. Or
Yes.
aware of what's going on in our bodies from either our animals
Yes.
or either our scalps. And so the technology that you just mentioned is very
Yes.
detailed, very
Yes, it
detailed.
is. Yes, it is.
Mm, 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 mm. I'm telling you, this is why I love referring to you as internationally known, because you are called to do many seminars all over the world. People, they listen to the wisdom that you have again obtained by taking time to study your craft.
Yes.
Trichology is a science, as you mentioned to us, that many of us were not aware of, and those that are now, we're getting some insight about that. So, how effective, which is kind of like a little redundant question, but I want you to elaborate a little more. How effective is trichology in regards to knowing what's going on with us beyond just the scalp and hair?
It is very, very crucial.
Yes.
I get a lot of referrals from other clients,
Mhm.
other hairstylists, even the natural hair locticians and professionals. They will refer their clients to me for an analysis when they see that there's something going on with your scalp that's beyond what I can do for you. So
Wow.
I really commend all of them for recognizing, look, this is beyond what I can do. And
Yeah.
so I'm able to put you under my microscope. And then we also do look
Love
at past history of your health.
it. Yes.
I take under consideration of that. And also with this COVID-19 and all of the variants that are constantly
Oh,
changing and mutating, this is
absolutely.
also impacting a lot of patients with hair loss.
Mm-hmm. Mm-hmm. Yes.
I'm
Is that
seeing
is
I'm
increased?
seeing more and more of that as well. So
Wow.
each person is a case by case basis,
Mm-hmm.
and I love to analyze them microscopically.
Wow. Wow. So we really need to be more in tune with what's going on in our bodies. And again, I want to commend the lacticians and all the beauticians that are taking time to be more proactive in assisting their clients by sending them to you,
Yes, yes,
because you
yes,
have the technology by being a board certified doctor of trichology. That helps so much. You are an
yes,
asset to us. Thank you,
yes.
Dr. A. So, because you're such an educator and you keep advancing by studying, let's talk more about your online university. Tell us more about
Yes.
what manifested, what caused you to say, let me take to the next step and help others.
Okay, so that started in 1999,
Mhm.
right after I finished the trichology curriculum. And there was no international trichology training center.
Oh,
And
wow.
so we opened one here in Arlington at my clinic. So
Okay.
I have had numerous professionals to come in for hands-on advanced training. So
Mm,
that's mainly what I like to specialize in.
yes.
If a specialist, a certified trichologist needs advanced training in a certain area, I can
Mhm.
customize a program for
Wow.
them. And they'll come in, they'll fly in, and usually it's a 1 to 2 day program. I can do up to 5 days of a specific program for them. So they will contact me, and then usually that's more of a hands-on. It's
Yeah.
not so much an online, yes, type of
Hands-on
opportunity.
type of training. Wow. But no,
Yes,
let me stand corrected. It is your curriculum that is available if someone wants to go advance. Is that correct? It's more of an advancement for their educational learning, but they do fly in.
yes, they do fly in.
Okay,
Yes,
that's
I've been
great.
asked about an online curriculum, but
Yes,
because this area is area of specialty, it does
yes,
require visual confirmation and really understanding what you're looking at.
yes.
Um, an in-person type of training is really best for this particular area.
That is so good. I know individuals that are interested in creating their own type of products, which you have. She's been the
Yes,
overseer of her products, and they are award winning. She has the technology for you. So I would say if that was my area of expertise, I would definitely contact you to enhance my skills and learn more, as you said, more hands on, so I know how to identify what type of
yes,
appropriate treatment that needs to be administered. So thank you for that. So radio host personality, I mean television personality, radio host. Oh my God, there's so much more to you. So share with us the radio personality and the television person. I mean the radio host and the person television personality.
Absolutely. But I first like to go back to my products.
Okay,
So my
please. Yes.
products, yes. So I did want to say that with my product line, I knew I wanted to offer my patients the best quality ingredients, but all natural. So I
Yes.
contacted one of the local manufacturing facilities,
Yes.
and I sat down with the chemist and I told them what I needed the products to address these particular conditions. And they came up with a formula for me. So I have my own exclusive formula, you guys.
Yes. Let's
And
talk
they have
on
done a wonderful
exclusive.
job. Yes. It's been on the market for over 17 years, and
17
we've
years.
had global success. And so we have 5 products that are award-winning products, recognized from the city of Arlington, as
Mm,
well as other areas. And that's why I can happily say that we have award-winning products.
yes,
So now,
products. Yes, an internationally known person that doctor, certified doctor, that the board certified doctor that has not only the heart for the people that I love and admire about you, but you want to make sure that not only you give them the right skills by the technology that you use. So you're not guessing. You're not the
right,
doctor that says, "Oh, let me try this medicine for you." You actually have the technology to identify, pinpoint what is going wrong in the scalp and in the hair. So
yes,
I'm glad that you did go back to your products because I always love saying internationally owned, award winning
yes,
products, hair and scalp products.
yes,
17 years, guys, that
yes,
God gave her this insight. And so she
yes.
manufactured with a chemist, and now we were seeing results. So, what kind of cases could you discuss with us that you saw that the average doctor, let me say that, might say, it's nothing we can really do for you, but you were able to reverse some things, or you just had to tell someone your scalp is damaged, but this is what we can do?
Okay, so once I analyze a person's scalp, um, thinking of some of the ones that are unusual that I've
Yes,
seen,
unusual cases.
um, I would say, well, as far as the hair thinning,
Hmm.
could be one of the top ones. Um, a lot of my patients have said when they've gone to another medical professional that they said, "Oh, it's just hereditary. Use this," and that's not always the case. Sometimes it's hair care practices, and that can be a very, very major cause for a lot of women because image is so important. So I try to always educate women. Think of the health of your scalp and hair versus image. But some people, they
Mm.
they do not want to listen when it comes to that image.
No, no, they want to do something that's breaking their hair off or damaging their hair scalp. Wow. Mm.
Yeah, that image, yes. So that's one. And then the alopecia areata is
Yes.
another one that I see quite often, the patchy alopecia that affects men, women, and children. The traction alopecia around the frontal hairline area.
Yes. Yes.
That is also a very common area. Sometimes it's reversible, sometimes it's irreversible. Depends on the degree of severity. Um, so, I could go on and on,
Yes.
but I'll just say those are some of the ones that come to mind immediately.
Okay. So, how imperative is it that we seek medical advice and then treatment when we begin to see challenges where no, this hair is just thinning and it's been now for about 6 months and it's nothing that I've done or that my hairstylist can do? How crucial is it that we seek your assistance?
Yes, any time you see any changes with your hair and or scalp. You need to contact a board certified trichologist immediately. Please do not prolong it. I have some cases where they have prolonged it from 5 years, 10
Oh
years,
wow.
15 years. And then they want to know, well, doc, can my hair regrow?
Uh,
You know,
where
so
you
what can you
at?
do to help my hair come back? You know, and sometimes it's been so long. And
Wow.
then I've had others, they come up with a long list of 15 and 20 different medications
Oh,
that they're on. And that's a lot.
that's a lot.
That's a lot.
That's a lot
So,
for the body, period. Ugh.
yeah, so depending on what the health condition is, that has also affected the scalp and the hair.
My
From lupus patients, I see a certain pattern of alopecia with lupus patients
mm,
compared to those who are diabetic. I see a different pattern. If you're type 1, there's a certain pattern that I see. So
interesting.
it just really, really varies.
Wow. So with you noticing and identifying that there's a pattern type, then that means that, and I know you collaborate with other doctors. So would you
Yeah.
encourage like oncologists and doctors that specialize in treating patients that are diabetic or even those with sickle cell? Would you have them to like encourage them to let's consult and let's see what we can do to help that person since you saw that there's a pattern in those type of illnesses?
Well, some medical doctors are open
Mhm.
to, talk to me, and others are not.
Mm. I
Others
think
are
that's in
not.
every field. I think that's in every field. I don't think
I
it's just in the
truly,
trichology, but I really, really do believe that I'm just speaking from a common sense perspective and being
right,
proactive for the good of the patient. And I know
right.
you're open because I've seen it throughout literature that you've written, also with just your bio. Your desire is to collaborate.
Yes,
So,
yes, yes,
you've learned very early in your 30 plus years that collaboration really assists, the good of the client,
yes.
the health of the patient. Let's talk about mustache and the grooming practices. How crucial is it? I want ladies and definitely
Oh,
men
let's
to
talk
hear
about it.
this. Oh my
Let's talk
God.
about that.
I'm
Okay,
still
so our
horrified from
men,
our conversation. I'm still in
so our
shock.
men, our men, please. Okay, so the
Yes,
facial hair.
help them.
If you keep it very short and neat, most women love that.
Yeah.
And it's easier for you to keep it clean. Now, those of you who like a longer mustache, especially over your mouth,
Mm.
that's not good because every time you eat something, every time you drink something, that is getting on your mustache and is getting in your beard. So some men, they do not realize the food particles. The food
Yes.
particles also get in your mustache and in your beard. And just wiping it is not enough. You need to
Mm.
physically wash that out with a towel and some soap and water. That way, that helps remove the food particles because this can also absorb any type of liquid that you drink. If you drink beer, if you drink milk, if you drink
Wow.
alcohol. So this can also absorb into your beard, and
Wow.
that's not good.
Not at
So
all.
you want to make sure. Say it again.
I said not at all. I'm like, ugh.
So please keep in mind that you need to wash that area just for
Yes.
hygiene purposes.
Oh God.
So facial hair, yes, can hold odor. It can hold what you're drinking and also food particles with what
Mm.
you are eating. So this is a health alert.
Yes, it
This is
is.
a health
Yes,
alert.
it is. Yes, it is. I'm so glad you're making it clear. Well, as we're wrapping things up, I want you to go back to your product. It's
Yes,
Therapeutic Essentials LLC for the head,
yes,
the scalp, and the skin.
yes.
Where can we contact you? How can we order products? Just give us a whole spiel about your products. There's 17 years success rate, award winning.
Yes.
You're internationally known for what you've been doing. And again, I'm so glad you came on the show so that you can share this information with so many who, because we really do not know how important and crucially important it is to care for the mustache, the beard, the scalp, and
Yes.
identify things. So just kind of elaborate what your products will do. You can go down the list of the things that you have. So thank you.
Absolutely. So, yes, my products are superior to other products in the market because they are
Yes.
award winning. So, we
Yes.
have our hair and scalp shampoo. This is going to give you a more thorough, in
Mhm.
depth cleansing of the scalp and the hair. It's also going to give you stimulation for hair growth. It has antibacterial, antifungal properties to help with mild forms of bacteria and fungus.
Yes.
If you
I
have more
know.
severe forms, you do need to go to a medical doctor. That's something that I do not address.
Ah,
It also helps to strengthen hair fibers
okay.
and softens the hair texture at the same time.
Oh,
So this is great for children, teenagers, as well as adults. Now, men, a
yes.
lot of men have used our shampoo to shave their bald head with. It works wonderful for shaving. Also, it's great for beard care, for facial hair. So it's really going to help to cleanse that and keep your skin from itching. Some men have very sensitive
Ah,
skin and it itches all the time because their
mhm.
hair is constantly growing. So this is really going to be very helpful with keeping your skin from itching. So
Yes.
that's our hair and scalp shampoo.
Mhm.
It has a low pH of 5.5. Then
Okay.
we have our revitalizer conditioner that has a pH of 5.3. So we wanted it to have a lower pH
Okay.
because it's it has healing properties for the scalp,
Wow.
very deep penetrating. It also helps with stimulation, with antifungal properties, antibacterial properties. It helps with folliculitis of the scalp, which are the pimples on the scalp. So that's called folliculitis, which is the mild bacterial infection of the hair follicles. So it will help to heal that.
Wow.
Um, it will help with the seborrheic dermatitis, the pityriasis simplex, which is commonly known as dandruff.
Mm-hmm.
Is very helpful with psoriasis. Now, for those who have the pityriasis amiantacea, we have a different treatment products
Okay.
that is available for that because that's more severe and that requires different products to specifically be more aggressive to
Yeah.
address that condition.
Okay.
So that's our revitalizer conditioner, and also it makes your scalp feel wonderful, tingling. It strengthens your hair, and you will
Wow.
really tell the difference. And then we have our anti-itch soothing oil, which is a maintenance product. So that can be used on the scalp. It's great for a man's beard also. It keeps it
Okay.
nice and soft.
Getting here
It
clean.
also gives a nice shine to their beard. So I recommend that also for our males.
Yes.
So
Yes.
we have the anti-itch soothing oil. Then we have our follicle serum. The follicle serum
Okay.
is another product that's great for giving more stimulation in between shampooing of the hair and scalp.
Oh, good.
So that product I recommend for a person to use every day per week. It gives a more aggressive stimulation, especially in your problem areas where you're thinning, patchy, or trying to get hair regrowth if the scalp is not damaged. So we've had tremendous success cases with that. Then we also have a moisturizer detangler. This is a maintenance product. It will not regrow your hair. It's a maintenance product to keep your hair moisturized and easy to comb and manage. So those are our 5 products. We had
Love
2
it.
skin products. We do have a shower gel, which is great for those who have eczema and dry skin, works very,
Yes.
very well. And then we had a hand and body cream. We're getting that back into our inventory because we had run
Good.
out. We had sold
Oh,
out.
wow.
So those are our
Your
2
product,
skin
right?
products that we have available. So yes, our products are absolutely wonderful. If you'd like to read some of our testimonials, I know
Okay.
testimonials are
Come
very
on, talk
important for
about them.
some.
They are. They are. They are. We need them.
So you can go to our website and you can read our long list of testimonials and see some of our before and after success cases.
Okay. I like
So the
that.
name of our business is LA's Hair and Scalp Clinic, and our website is hairandscalpessentials.com. Hairandscalpessentials.com. And then you had asked me about my radio history
Yes,
also.
the
I didn't
radio
answer that.
personality. I mean, radio host, and yeah, I wanted to know more about that, and even how
Okay.
you first got on television. That started from your
Okay.
journalism. But I want the audience to hear
Yes.
that, and then we'll wrap it up.
Okay, yes. But one more thing, I'd like to talk
Okay.
about my upcoming event on
Oh
July
yes,
17th.
yes. Oh my God, yes. The community thing.
Okay.
She's also a community person. Yes, yes, yes. I've been posting it. Share, share.
Okay, so with my television as a radio host and television personality, once I got into this field, God is so good. So many other opportunities began opening for me. So I began doing so many interviews on so many radio shows, television shows, a lot of the local networks. I would do television shows. And so that really helped to propel my practice so people
Oh,
would know exactly what do you do.
what do
And
you do?
so that really helped in that aspect. And then also writing for local newspapers, which morphed into me reaching out to other magazines.
Yes.
And I started submitting articles. They loved it and they printed it. So now I've been blessed to be featured in 80 national magazine
80
publications.
national guys, 80 national magazines. I read that. I was like, whoa. But
Yes,
that's
so
what
I
happens
have
when
been
you have
really,
award winning products.
yes, so I've been on a journey. I've been on a journey. So now with the podcast, the radio show.
Yes.
So after being on so many radio shows, I said, I think I can do this, even though I do not have a background as a radio personality. I said, I can do this. So with the podcast, I started back in 2013,
Hmm.
and my show was called Ask the Hair and Scalp Doctor.
Ask the
And
parents.
so I just started educating more about alopecia, scalp disorders. And then I wanted to bring in other guests to just educate my listening audience on a variety of topics. So that's what we included, just a variety of topics to educate my listening audience. And I learned so much from all of my guests. It was a learning experience for me as well.
Wow.
Yes.
Wow. So it doesn't stop with you. It always
It
progresses
doesn't stop.
and it
Doesn't stop.
always makes it good. But we benefit from you. I always think about the person that God elevates and what you bring to the table. It's just not stopping at your doorstep. Your doorstep. It actually spreads out to others. Your technology, your scientific studies, and I love it. I love everything that you're doing. But let's talk about the community outreach that you're
Community,
doing.
yes. So
Community.
also in 2012, I
Yeah.
began I began my scholarship. So initially I wanted to give back to a youth between the ages of 16 through 19 who was diagnosed with alopecia, but
Mhm.
still pursuing education in some capacity. And
That
so
is
I had an essay contest where they had to write an essay of my choice. I would choose the topic, and it had
okay.
to be 300 words. So I started I did my first one, and that created so much other media for me,
Yeah.
which was truly a blessing.
Yes.
And so we did my first cruise with a purpose on the Carnival
Food
Cruise
for
Line.
purpose. I love it.
So we had a blast. Kayla Staples was my very first scholarship winner, and
Okay.
her parents came, and I had a group of other family and friends, and we had a great time. And so that has continued. So currently, I'm on my ninth year of
Ooh,
hosting my scholarship, but
and
I
that's
have chosen an organization this year, which is a
okay.
501c3.
Okay. Okay.
It's called I Look Like Love,
Okay.
and she is right within the demographics of 16 through 19. So Her program, I love her program, and
Yes.
she helps young women who are pregnant uh, have the resources that they need in order to be successful and to take care of their children.
Now that's a
So I,
great cause.
so yeah, so that's a great program that she has,
Hmm.
and we worked together last year with one of her
Okay.
diaper day drives.
Okay.
Yes, so we've done that. So now I am doing a community service recognition event
Mhm.
on Sunday,
Yay.
July the 17th, next Sunday.
Yes. Next Sunday.
And
Yes.
so, with that, I have chosen four nonprofits in which I'm going to recognize them
Mm.
for their community service. My scholarship winner is also going to be present. So I'm going to introduce her to the community as my
Mm.
scholarship winner, and she'll be able
Yes.
to share what she's doing in the community.
Hmm.
I also have two car clubs that I reached out to. The men in these car clubs are also very, very active doing community service, which I love what they are doing.
Yes.
And then I also have the hashtag Diabetes Squad Up, Miss
Yes.
Angela Whitman.
Yes.
I'm going to recognize her for her efforts. She is really trying
Yes.
to educate the community about the
Uh,
importance of diabetes
yes.
and to take care of your health. That is so
Take care of
important.
your health. So
So, if
important.
anyone who is tuned in today who has diabetes,
Uh,
please take your health very serious. Very,
yes.
very serious.
Absolutely. Thank you.
So, yes,
You're doing great work. I just love it. I love it. I love hearing you, speak of all the other people. And it's not just about you, you're bringing others in. So I thank you for being selfless.
thank you. Thank
Yes.
you.
Anything else that you want to share with us before we wrap it up? Because I'm just so grateful you came on and share so much wealth of information, a wealth of knowledge. You dispelled all the myths and the assumptions that we have about hair care, hair and scalp, and also just things that we take for granted. You've shared with us we need to take care, especially the mustache and the beard, guys. You must listen to this replay. If you with
Yes.
someone who has a beard on a mustache, listen to what the doctor has said. Dr. A gave some great information, but go ahead with your wisdom nuggets, please.
Yes, so please contact me. We offer virtual consultations as well as clinic consultations. So if you do not live in the DFW area, we can still assist you with a virtual consultation. And we also have a mail in service for your hair strands. So we have a postal kit that we can send you for the epigenetic hair bulb analysis, where you can receive your 37-page report, and then we can do a Zoom review because I want you to understand that report. So that's what I do for those who want the mail-in service. And then we have others who mail in their hair bulb, and I will analyze it. I type a report and I send that back to them with my
Wow.
findings. So there are
Girl.
two different types of mail-in opportunities.
Ah,
And so we have the virtual, we also have clinic, and then also I travel.
yes,
So
she.
if we have if we have a group of at least 8 to 10 individuals who would love to have an analysis, I can travel to your area and we can set that up. And I
Yes.
have done that in a hotel setting. So
Okay.
I have a suite where we can do that in a hotel setting, and that has worked very, very well also. So I have another business partner in San Antonio, in which we partner and do those type of referral services. And I have another doctor, she's in Georgia as well, a Dr. Cooper. And we also work together with our knowledge and expertise. So I'm
Yes.
excited with what the future has in store.
Yes. Great
And
things. Great things.
I would love to assist anyone who would like to contact me. CEO of LA's Hair and Scalp Clinic, 2304 West Pioneer Parkway, Suite number 6, Pantego, Texas, 76013. Our phone number is 817-265-8854, 817-265-8854. And again, our website is hairandscalpessentials.com.
Scalp.
Hair and Scalp
Dot
Essentials.com.
com. I
We would
love it.
love to help you.
Thank you. And I believe it and we know it. We're going to sign off together. Thank you for tuning in today on Health Matters with Dr. A. Hair and Scalp Essentials.com is how you can locate her. Give your phone number once again, Dr. A.
817-265-8854.
Thank you again. She shares so much, a wealth of information. I encourage you to like, share, follow, and subscribe, but also more importantly, contact Dr. A. Utilize all of the avenues that she mentioned that she has available to you. Technology is great and it is our greatest asset right now, along with Dr. A. And you have a mail in service that I think is two opportunities to use the mail service. So they just need to contact you for a
Yes.
consultation and go from there. So, again, thank you for tuning in to Simply Free Little Talk. Again, like, share, and subscribe. Thank you. Bye bye.
Thank you. Bye-bye.